Doc, over to you. Welcome.
Thank you.
You're looking lovely, by the way.
Thank you so much.
Great. Peptic ulcers. Last week, we just couldn't exhaust everything. We had people still sending messages, people sending pictures of their drugs, trying to confirm whether they're on the right path, right? So we'll try and just wrap up where we started from last week and try and also end the conversation properly this week.
Okay.
So just a brief overview of what last week looked like.
Okay, so peptic ulcer disease, we usually would call it PUD. So it's when you have an ulcer within either the stomach, or when you have a sore within the stomach, or the first part of the duodenum. Okay, so basically you have the gastric ulcer, and then you also have the duodenal ulcer, depending on where the breach is. So it's just a breach in the lining of these areas. And usually we have what we call the H. pylori being one of the risk factors. Once you have this infection of the H. pylori, it stays there and then it causes the ulcer not to heal. So eventually the ulcer continues to grow, and then you end up with other complications if it's not treated. And then we also went on to talk about the fact that there are certain signs and symptoms that may prompt you that I have an ulcer. Usually it has to do with pain. You may end up having pain above the navel. We call that area the epigastric region, where the pain usually differ depending on where the ulcer is. So I mentioned that for gastric ulcers, usually the pain is worse when you eat. So such patients tend to avoid eating, because it's only when they eat that is when, once you have eaten, there's food in the stomach. There's something we call peristalsis. Peristalsis is contractions and relaxations of the stomach to help with digestion. So once these contractions and relaxations go on, it tends to wrap on the ulcers, and the patient tends to have a lot of pain. So people with gastric ulcers usually do not want to eat, because that is when they have their pain becoming much more worse. So they tend to either induce vomiting after eating, or they avoid eating at all, and then this leads to them losing a lot of weight, as opposed to those who have duodenal ulcers, where the pain is rather relieved on eating. So they tend to eat a lot. So they tend to have what we call binge eating. So eating anytime they feel the pain, and this can let them end up gaining a lot of weight, as opposed to those who have the gastric ulcers. And then we also spoke about certain tests that you can do for you to be able to diagnose whether you have an ulcer or you do not have an ulcer. And these tests, we said we can do, the most sensitive is doing an upper GI endoscopy, where a small flexible camera is passed through the mouth, and then you can visualize the lining of the stomach and then the duodenum as well. And then you would be able to tell exactly where the ulcer is, and you can take some biopsies as well. So when I say a biopsy, you can take a piece of it and then test for the H. pylori. Once you test for the H. pylori and the H. pylori is positive, then you would have to go through setting therapy. We call it either the triple therapy or the quadruple therapy, where a combination of antibiotics are used to be able to eradicate the H. pylori organism. And then you're also put on something we call the PPIs. They are proton pump inhibitors that tend to reduce the production of gastric acid or HCl within the stomach, so that it can have an uneventful healing. And once that is done, you need to have a long-term follow-up, where you have to go back for another endoscopy to be done to be sure that the ulcer has healed, and then to also be sure that you have been eradicated of the H. pylori.
We'll come to treatment of that's peptic ulcers, right?
Yeah.
But just before we even touch on that, is it possible to have a relapse of, like, let's say, peptic ulcer or ulcer, in the sense that you've treated it, it looks like you're fine, and it resurfaces again.
Yes, it is, because mainly because of the fact that I said one of the main risk factors is you being infected with the H. pylori organism, and H. pylori organism, we meet it almost every time. Either you are eating anything contaminated, so that we call it orophycal contamination of your food or your water, or it can be oral spread, that's through kissing or what have you, from secretions. So once you have these infections, or you have introduction of this H. pylori into your system, either intentionally or unintentionally, and it also depends on the virulence of the H. pylori, and then your host's, your immunity as well. So at any point in time, once maybe your immunity is a little low, and then you have the H. pylori, a more virulent H. pylori getting into your system, yes, there are chances that you can end up having another infection, and this infection may end up becoming an ulcer again. And mind you, once you've had the ulcer, it's actually puts you at a higher risk of having another infection as opposed to somebody who hasn't had it before. And there are times that...
No, go ahead. Sorry, finish.
And there are times that people may not have the ulcer, the frank ulcer, but they may end up having what we call inflammation. So gastritis, we call it gastritis, where the lining is just inflamed, it's swollen. And then that can also end up giving you some pain, mimicking typical of the H. pylori.
There are people who, when they eat certain things like pineapple or orange or
high acidic,
something, they get
content.
heartburns. High acidic content foods, they get heartburns. Is that an ulcer, or that's something completely different?
So that could actually be something we call retrosternal pain, or gastric esophageal reflux disease. So gastric esophageal reflux disease is sometimes when you have, there's this sphincter around the stomach. When it is incompetent, it's supposed to be closed. But when it's incompetent, such that anything you put in can be regurgitated up. So you tend to have this pain just behind your breastbone. Yes, is typical of either gastric esophageal reflux disease, or it can be even gastritis. So it can be many of things. And you having to take these fruit that contain a lot of acids predisposes you to getting an ulcer, in the sense that these high acidic content foods can have a direct effect on the lining of the stomach or the duodenum, and then this can lead to some ulceration. So it actually gives the H. pylori a conducive environment for it to infect the area and then continue to proliferate, and then eventually may end up with an ulceration. But once there's inflammation, or once there's swelling in the lining, yes, you can end up with some retrosternal pain, or the pain that you're talking about, the epigastric pain, and that needs to be investigated for you to be sure whether you do have gastritis, or you do have H. pylori infection, or you do have an ulcer, and all of these need to be appropriately managed.
What kind of complications are associated with peptic ulcer
disease? Okay, so these complications usually, so it depends on the state of the ulcer. So when you have the ulcer eroding deeper, and then unfortunately eroding into a blood vessel, it means that it's going to cause blood vessels contain blood. Okay, so once it gets to erode the blood vessel, it means that you are going to puncture that blood vessel. And you all know, once you puncture blood vessel within the stomach,
you die.
You end up pouring a lot into your stomach. So the patient may end up with bleeding. So we
that's
call
internal.
it upper, yes. So we call it upper GI bleeding.
Okay.
So once this bleeding is torrential, sometimes, I mean, it comes out. It's an irritant as well. So it comes out, and you may end up having very severe anemia, and this can, if it is not intervened or an intervention is not instituted immediately, it can lead to the death of the patient. Another complication could be that this ulcer if it is there for a very long time, chronic, it will cause changes in the cells. So these changes will now end up becoming metaplastic, dysplastic. It can end up with a cancer within the stomach. You get it? So once you have a cancer within the stomach, and then this cancer occludes or it narrows the path of the stomach through to the duodenum, it will end up causing something we call gastroesophageal reflux disease, or it can end up causing something we call, it will occlude it. Once it occludes it, you may end up causing obstruction. That is what I should say. Yes, it will end up causing obstruction. And this obstruction will mean that it becomes an emergency that you would have to quickly be seen. And then once you know there's a cancer, this cancer would come with all of its problems. That is inability for you to eat properly, and then it is eating away your whole self. You end up becoming cachectic, that is losing a lot of weight. You can't eat because when you eat, it can't go down the way it should go down because there is something blocking that area. And then it can also spread to other areas of your body. It can go to your chest, it can go to your bones, it can go to almost every part of your body, and that can become problematic. So it's either you have an ulcer, long-standing ulcer that hasn't been treated, and usually you see it in the elderly. It hasn't been treated for a very long time, and then it changes in the molecular level. So you end up with a cancer. Once you end up with that cancer, so imagine, we've spoken about cancer here before. Imagine you having a cancer within the stomach. Yes, so you end up with...
Your chances of survival are close to
nothing,
really.
So you end up with gastric outlet obstruction. So it obstructs the area, and then whatever that you eat and it gets into the stomach, it can't go down. So it would keep accumulating, and that becomes an emergency. Or the bleeding that I spoke about. And the bleeding, it's usually very, very, it's an emergency that needs to be sorted out as soon as possible. So otherwise, surgery? You can pour out. So not necessarily, because you are pouring out, what we would want to do in the interim is to stop the bleeding. So it depends whether the bleeding is coming from an artery or is coming from a vein. So what we want to do is that the initial thing that we want to do is we want to reduce the acid that is being produced in the stomach. So you reduce it as much as possible so that it doesn't irritate the blood vessel to cause more bleeding. You get it? So we'll put you on high dose PPIs to help stabilize and then stop the bleeding so that the body can form a clot on whatever that is bleeding. That is one. Once that has quietened, and we are sure that it has quietened for some time, the next thing that you would want to do is to resuscitate the patient. You quickly check how much blood do they have. Let's replace whatever that they have lost. So you want to replace so that the patient is optimal. Then you would want to look inside the stomach to see. So you would want to look maybe after 24 hours, once the patient is on the ward and is not vomiting any blood, you would want to look and see. So you go back in again with the camera to see. So once you see, you'll be able to tell exactly where the bleeding is coming from. So if you're able to tell where the bleeding is coming, there are certain local therapies that you can do. You can do something we call cryotherapy, where you freeze it so that it stops the bleeding, it occludes it. Or you can do something we call band ligation. So band ligation is you just go in and then you tie whatever that is bleeding, and then make sure that the area is not bleeding anymore. And then there are times that all of these may end up failing. And you have to end up going in and then do something more extensive. Yes, so once you do all of these, then you check weights, and then you would likely, for these patients, they would have the H. pylori infection most of the time because of the long-standing.
Messages here for you. This one is from Sandra in Teshi. Says, good morning. Please ask the doctor what advice would you give to a pregnant woman with peptic ulcer?
Okay. So a pregnant woman with peptic ulcer disease, what we will do is that because we would want to check which trimester she is in.
Right.
Most of the time. So if she's in her first trimester, usually we don't want to give a lot of medications in their first trimester because of the fact that that is when the formation of the fetus is, and we don't want to give, and most of the medications around that time may end up causing problems to the baby or the fetus. So the safest period to be able to treat any pregnant woman would be in her second trimester.
Okay.
So in the second trimester, yes, we can give some of these medications. Amoxiclav is safe. You can give amoxiclav. You can give the PPIs as well to help reduce the acid production, and then manage her a little conservatively till she has delivered. Then you can
do a full treatment.
Exactly.
Well, I wanted to just ask you, because I was curious about how common or prevalent death-related or peptic ulcer death-related cases are.
Yeah.
Then maybe you can also help us with, for those who've already gone through treatment, what should be the new life going forward, right? So just maybe some data if you have them, then how to manage yourself post peptic ulcer treatment. Okay,
so I'll start maybe with how to manage yourself post treatment. So you have to be much more careful. Your hand hygiene, and then even your food, the food that you eat, make sure that is usually hot, is heated, and in terms of, I mean, if it has to do with your partner, stick to your partner and make sure that your partner has also been treated properly and eradicated.
So we say it's a sexually transmitted disease?
No, it's not a sexually transmitted disease, but it has to do with
so what are
secretions.
Okay.
So H. pylori, because it's within the gut, anytime there's kissing, the likelihood of you transferring is there. So it's just through secretions, and your saliva is one of the ways through which you can get it.
So does that mean that if you have a partner, you have to drag the person to the hospital with you?
Yes. Once you have had, let's say for the recurrent diseases, somebody has had peptic ulcer, has been treated, and then had another episode again. So it's likely, and then you know that you have just one partner. Yes, you need to have them checked for the H. pylori as well, so that they are eradicated of it. Otherwise, you'd end up having recurrent infections over and over and over, and that can end up predisposing you to these
or killing
ulcers.
You. I see a lot of the time you try not to create a very doomed picture, but that is what it really is, right?
Yes.
Because I listen to you talk
Sometimes
about.
You need to scare the patients, otherwise you won't get up and go.
Because I listen to you talk about bleeding inside. I'm like, how are you surviving that? Like, your chances are really slim.
Yes, the chances are actually very slim. It's usually an emergency, and it has to do with when it is found. So if you are lucky and you are found early, yes, there's something we can do to help.
It's not a laughing matter.
Well, I see that she's trying to manage it to not make it sound very, but it is what it is.
What it is.
Yeah, that's true. So if you are lucky and you are found early, yes, we'll do our best to be able to have you out of that situation. But if not, and imagine it happens maybe somewhere at home, then it becomes with our ambulance services not being sharp enough, yes, then it becomes something else. Maybe the story becomes
for money before they move. Can you imagine?
Yeah, so maybe the story becomes a different one. Yes. So what I'll advise is that once you start feeling that pain before eating, or anytime you're about to eat, you feel the pain, or there are times that you have this pain just above the navel region, which we call the epigastric region, and it's persistent, how I have described them, please visit the nearest health facility and have you checked. Once it is something that you can easily treat, so don't wait for you to get to the complications where it becomes very, very difficult to treat them. Yes. And then there was another question there.
Yeah, so like the Kesri data on the death related.
The death related. Okay, so the death related. So another complication I forgot to mention is aside the bleeding, and then it's transforming into a malignancy or a cancer, it can perforate.
Oh.
Yes. So it can. So perforation is like you get a hole. Yes. So if it creates a hole, imagine you pouring this acidic stomach content into your body cavity. That also becomes an emergency.
That becomes a death sentence.
Yes, not a death sentence. Yes. So what I have noticed is that the younger people, usually when they have a perforation, they tend to heal faster.
Oh, okay.
So it has to go into surgery for the wherever the perforation is. It has to be repaired in surgery. So you definitely have to go to theater, and that has to be repaired. But I've noticed that the recovery for the younger generation, it takes time. It really would take time because you are very sick. It takes time, but they tend to bounce back, and then they are discharged home alive.
We'll come to the data, but still on there. Somebody wants to ask if alcohol is a no-go area for those who are recovering or those who are seeking treatment.
Yes,
up
definitely.
Until they leave the face of earth.
Yes, not necessarily, but well, alcohol is related to so many. It's related to so many diseases, but once you have peptic ulcer disease, yes, alcohol. I mentioned it last week.
Yeah.
Alcohol, you need to stay away from alcohol because it has its own caustic effects on the lining of the stomach as well, especially those who are heavy drinkers, who end up drinking a lot at a time. So they are not eating well, 1, 2, they are drinking a lot. So you end up having a lot of this within the gastric mucosa, which would also make it conducive for your H. pylori and then even make the ulcer worse. You get it? Yes. So yes, definitely alcohol intake has to be reduced or even nil at all. Cuts everything. And then you need to also check you taking over-the-counter medications like the non-selective, non-steroidal anti-inflammatory, like Brufen, like Diclo, all of those. You need to check it. And anytime you are taking these medications, make sure that it's on a full stomach. You would have eaten properly so that these medications don't have a direct effect on the lining and then make the ulcer worse.
Oh. Someone wants to find out if peptic ulcer disease can develop in babies.
I haven't seen many in babies yet, but I would say that there's nothing like no in medicine. Yes.
You're always finding new things and stuff like that.
But the prevalence is usually those in their what's the name, 2nd decade, 3rd decade upwards. Yes, but then never say never to anything.
Doc, time is far gone, and we'll have to end it here. But what would be your final word to anybody watching in terms of trying to keep safe, trying to be on the right path, right? Because a lot of people, our lifestyle, right, our sedentary lifestyle and stuff like that predisposes us to a lot of the things you come on here to talk about. So maybe your final message to all of those watching right now.
Okay, so what I would say is that yes, peptic ulcer disease is a very prevalent disease here in Ghana, and we need to be aware of the fact that anytime you have any of these signs and symptoms of having an epigastric pain, please visit the nearest hospital and make sure that it is checked and then diagnosed properly. Once it is diagnosed, make sure you go through the treatment and then precautionary measures by making sure that you eat properly, making sure that you hydrate as much as possible, you drink moderately, and then avoid taking these NSAIDs on an empty stomach. Make sure that you have eaten properly and you're exercising as much as possible. All of these modifiable factors that I have just mentioned would help boost your immunity. Once it boosts your immunity, it reduces the rate at which you get some of these infections that can escalate and end up becoming these ulcers, which become very difficult to treat in the long run. So stay safe and make sure that you are exercising and keeping safe as usual.
Interesting. So stay safe. Stay safe. Make sure that you're exercising
And
so you don't
eating
find
properly.
yourself really one. But somebody wants to just briefly find out if it can cause you to lose weight.
Yes, I mentioned, yes. It can cause you to lose weight, especially the gastric ulcers. So the gastric type, yes, because of the fact that anytime you eat, it makes the pain worse. So people tend to avoid eating, and that can lead to
I mean, I remember when you talked about the
yes,
the
and that
balance
can
over
lead
there.
to
Wow.
you actually losing a lot of weight.
Doc, thank you so much for your time. Doc
Most
Kalsum,
welcome. Thank
Zakaria,
you too.
Adam, a favorite on the show, always helping us through these very important conversations that help us keep safe, really, so we are able to take charge of our life. Like a very famous saying goes, health is wealth, right? So you could have all the money, but if you don't have the health, what's really the point? So guys, be safe, keep safe, exercise regularly, the alcohol intake, manage it, right? And you'll be happy for it and you'll be better off for it.